An X-ray of the foot identifies bones in the feet. Normal foot X-ray. An X-ray of the foot is an image that shows the bones in the feet. It shows any abnormality in the bone, such as fractures. It can also detect changes caused by disease, such as arthritis or bone disease. It can help doctors identify the position of foreign objects in a wound. Children can undergo a gamma ray of their feet if they are suffering from an inversion injury. The bones of a child's foot do not look like those of an adult. Normal foot X-ray. This is due to the fact that the foot's bones are not fully developed. They are more easily damaged by a sprain than by a broken bone, which can take months or even years to heal. An X-ray of a child's foot will show the development of these bones, allowing your doctor to diagnose any problems early. An X-ray of the foot can help your doctor diagnose many common symptoms in children. It can help determine if a child has broken bones or dislocated joints, as well as assess the proper alignment of bones. It can also help plan surgery and evaluate the outcome. A foot X-ray may be necessary to detect the presence of tumors, cysts, or infections in the bones. Unlike a sprain, a fractured foot should not require surgery. In a DP view, the second metatarsal should align with the intermediate cuneiform and the third metatarsal should align with the lateral cuneiform. A disruption of this ligament will make the foot unstable. An oblique view of the foot can show this injury. The oblique view of the foot X-ray will not reveal the injury. A plain X-ray may not be clear enough to spot the problem. Further imaging is necessary. X-rays of the foot are routinely ordered in the event of trauma, various foot ailments, and fractures. Normal foot X-ray. The oblique and anteroposterior views can show any irregularities. An oblique view can reveal more details, including the navicular bone. Moreover, an oblique view is helpful in evaluating the lateral tarsals and the calcaneus. While a DP view is not a lateral view, the third metatarsal should align with the intermediate cuneiform. The oblique view shows the bones of the second and third metatarsals. Frank injuries, which occur in the middle of the foot, can be seen on plain X-rays. Further imaging is necessary for a full diagnosis. If you suspect that the bones are not aligned, the splint may be the culprit. An oblique view is helpful in diagnosing dislocated or broken bones. An anteroposterior view of the foot shows the entire structure. Similarly, an anteroposterior X-ray of the foot is helpful in determining arthritis. It is also useful to find out what type of trauma the patient has suffered. If the pain has spread to the bones, the X-ray can help in determining the cause. A foot X-ray is a basic diagnostic tool for orthopedic conditions. Normal foot X-ray. It helps doctors determine the cause of common symptoms. It can also detect fractures and dislocated joints. It can also assess the healing of bones and ensure proper alignment. Moreover, a foot X-ray is useful in planning and assessing surgical procedures. It can also detect cancers and later stage infections of the bones. These types of X-rays are essential in diagnosing certain types of disorders. X-rays of the foot can show fractures and dislocations of joints. An X-ray can also reveal bone deformities such as humertos. A general X-ray of the foot can also show general pain in the foot, tenderness, or swelling. The X-rays of the foot can also help in diagnosing arthritis and rejoint deformities. The X-ray of the foot can help determine if there are any fractures or joint problems in the foot. A foot X-ray is a very important diagnostic tool for the diagnosis of fractures in the feet. It can be used to check for broken bones after an accident or to diagnose medical conditions. This scan uses a small amount of radiation and is completely safe. This type of X-ray can be interpreted by a physician without the need for a specialized training. However, a medical professional should always perform a proper X-ray to diagnose injuries. Normal foot X-ray. Normal foot X-ray. Normal foot X-ray.